A year ago, at the age of 31, this woman, Karen Christian, learnt she had breast cancer. A few weeks after her diagnosis, she underwent surgery. The next step was chemotherapy. Karen knew it would be traumatic. 15 weeks of hell, and the thought of losing her beautiful hair made the idea of treatment even more unbearable, kind of adding insult to injury, really. So she looked for a way to beat the drugs and save her hair, and she found it. Tristram Clayton has the story.
5 months ago, Karen Christian was in the final week of chemotherapy for breast cancer.
Yep, so that's from the front, and you can't really see it.
This is her at the time, and yes, she's still got almost all her hair.
So all I used to wear is just a black headband on top, and no one used to notice. I did have one oncologist chatting to me one time, and he said to me, he's like, oh, well, you know, this is all going to be over soon and you won't need to, you know, you can stop wearing your wig. And I said, I'm not wearing a wig. And so he was pretty surprised.
It was an outcome she never thought possible when first told she'd need 9 chemotherapy sessions over 15 weeks.
What were your thoughts when you heard that word chemo?
Oh, immediately hair falling out. That was it. I was like, I do not want to be a bald person. It's just not in my nature. So, I just did heaps of research about trying to keep my hair.
What she found was a device called the Penguin Cold Cap.
Actually, I've taken this straight out of the freezer to show you.
So how cold's this one?
This one is minus 35 degrees.
Todd Yelovich brought the caps to New Zealand when his own wife was diagnosed with breast cancer 4 years ago.
The coldness closes the hair follicles, and that stops the blood supply going into your hair, which also stops the chemotherapy chemicals from going into your hair, which of course stops the hair from falling out. So if you just hold your hand on the top of it...
Patients wear the caps, which cost around $500 per session, from an hour before chemo begins.
All right, so it's cold, but it's not too bad.
Yeah, I mean...
Until 4 hours after it ends.
That allows the chemicals in your blood to be purified by your body, and then once they're all gone, then you can stop using the caps, and you know your hair's going to be a bit safer.
Patients also need a support person to help change the caps every half hour.
It was a little bit of a challenge. It was, you know, they're very cold, but it was a good distraction from really what was happening with the chemo and the cancer, and really the cold caps are easy really with the whole chemo experience.
So what was it about them that helped you in your recovery?
Well, the main reason I wanted to use them was I didn't want my children to know how sick I was. They were both at primary school, and they, you know, it was just once you see your mum with no hair and she's got cancer, then they worry that she's going to die, and it just made everything a lot easier. And I could just go out and carry on like normal. Didn't feel like I was as sick as I was.
Like Donella, Karen says keeping her hair helped her recovery.
Yeah, definitely. And it helped so much because you're physically feeling sick. So to be able to look in the mirror and not see a sick cancer person, I think psychologically that plays a really big part.
Both women say information about the caps should be given to all new cancer sufferers, but so far hospitals are resisting their advice.
I don't think we have enough evidence to recommend its use as a safe and effective way of preventing hair loss. It may work to some extent in some people, however, we don't have enough data to support its use. But if a patient asks me, I do discuss it, and if they make an informed decision, then I'm comfortable with that.
Dr. Sassy Duran also has doubts about the way the caps work.
You are restricting the blood flow and preventing the effective delivery of chemotherapy to the scalp, then there is a potential, at least a theoretical concern, that you can increase cancer secondaries in the scalp.
Despite her concerns, the caps are increasingly popular overseas. They're already used in over 130 hospitals in Europe and in a growing number of hospitals in America and Australia. And for those who have used them, the lack of large-scale studies and theoretical concerns about safety is more than offset by the benefits.
I think everybody should know about them and have the right to choose whether they want to use them or not. It's, you know, it just takes a whole hard part of the chemo away that you don't need to go through.
You'd recommend it to others?
I would definitely recommend it to others, yeah. If you feel that your hair is important to you as a person and you want to keep it, use them.
It works.
They work.